Hey everybody, I'm Dr. JC. This is the truth about eye care and your eyes. In today's video, we're talking about visual disturbances. So just weird things that you see in your vision. Actually, over the next two videos, we're talking about this. Today, we're going to focus on floaters, flashes of light, and retinal detachments a little bit. Then in the next video, you'll hear a little bit about ophthalmic migraines. Maybe you see a little spot in your vision sometimes. Maybe sometimes it goes away, then it comes back and you see it kind of moving around, or kind of as you move your eyes across the room, you see it kind of following with your eyes. We call them floaters, so that's something that everybody has probably at some point in your life. Also related to that is a flash of light. You see flashes of light like a strobe light effect, or maybe you just see a big light all at once and then it stops. That can be a similar issue. Here's an example of what you might see with floaters in your vision. Might look something like that. Okay, so I want to talk to you about what it is, what the floaters and flashes of light, first of all, what that means. I got this little eye model here I want to show you. This is the front of the eye. Okay, light comes in through that way, goes all the way back to the back of the eye. Okay, if you come to my office and get an exam, I'm going to show you a whole picture of the inside of your eye and we can look at all this stuff together. But for what I'm going to say today, I think it's easier if you kind of visualize this. So inside the eye, normally it's not hollow, okay? Normally there's like a jelly fluid in there called the vitreous. Now the vitreous, it kind of moves around, it kind of changes size and shape as you get older. And it starts off, when you're younger, it's kind of sealed to the back of the eye. And then as you get older, and it kind of shrinks, and it will pull and work its way loose from what's called the retina. Okay, this is the retina, that's your optic nerve going back to your brain right there. Of course, the blood vessels come through it and go all throughout the retina. But the vitreous is attached. Okay, now you can get vitreous detachments and some other things that happen all at once, and maybe we'll do a little more on that later. But what we're talking about, though, is when the vitreous starts to pull on the retina. Okay, little pieces of it might come off at a time. Okay, rather than just the whole thing come off all at once. And if you have a little strand or a little piece of pigment, a little vitreal strand that pulls loose, it can get suspended in that jelly-like substance. It can be what we call a floater. You may see it. As you move your eyes, this little floater will move around in that jelly. Okay? Sometimes it gets kind of stuck in one little spot. It seems like it takes it forever to go away. But they do settle down and go away. Eventually they will disintegrate or go down to the bottom of the eye. Now, flashes of light happen when the vitreous pulls on the retina. Okay? So we talked about floaters being when it kind of pulls a piece loose, okay? Vitreous detachment being when it pulls the whole thing loose all at once. But when you get that tugging or that sensation of it pulling, you can see, it kind of tricks the retina. The retina is used to seeing light, right? That's the whole function of the retina in the eye, is to perceive light. Well, when the retina gets pulled on like that, it thinks it's seeing light, even though it's not. It's pulling on the photoreceptors, giving them a tug, and it makes you think that you're seeing light, or makes the brain think that you're seeing light. Okay, so you'll see that flash of light even though it's not really there. Now that will go away too as it pulls all the way loose or just quits tugging. And that's perfectly normal. Okay, to have any type of floaters and flashes of light can happen with aging or with maybe following certain surgeries or with just normal wear and tear on the eye. So, like I said, for those symptoms, the flashes of light and the floaters, they kind of stem from the same thing, that vitreal degeneration we call it. But they're not really that harmful. Okay, unless they start to take stuff loose with them from the back of the eye. Now, with the eye model, you saw the blood vessels there. You do have a lot of blood vessels on your retina. If one of those gets pulled on, kind of pulls loose, it can, or hurt enough that it leaks some blood. That can cause a problem, a blood vessel burst in the back of the eye, or it could, tear a piece of the retina with it. And if the retina comes off, then you get what's called a retinal tear or a retinal hole. You can even get a retinal detachment where the whole thing starts caving in. Retinal detachments are basically the worst thing that you can have happen with all these symptoms, okay? And that's the urgent thing, a retinal tear, a retinal detachment. You want to get it repaired as soon as possible, okay? And so if you see something like a sudden increase in a whole lot of floaters, a whole lot of flashes of light, way more than normal, all of a sudden, then you need to get your eyes checked, okay? You need to get out to an optometrist, let them check your eye, ophthalmologist, emergency room, anybody, whatever you can get to at the time. Let them check it, let them give you peace of mind that you're not having a retinal detachment. You don't want to wait a long time to get a detachment repaired. If your doctor tells you you have one, you need to go that day immediately. I'm not going to get into the details of the surgery and what all they do, but you basically get your retina tacked back down with a laser. Okay, the retinal or tear or hole or even detachment can be repaired very easily as long as you get there immediately as soon as it happens. Now, if you wait too long, you can run the risk of losing vision permanently. There are some other things that can happen just naturally that can put you more at risk of having a detachment or a tear. One thing is just being really nearsighted. People who have nearsighted eyes, you know, we think of the eyeball as being perfectly round like this one. Not necessarily. If you're someone who's nearsighted, your eye does tend to grow and elongate more as you get older. So it's actually stretching out this way. Which causes, that stretching causes the pooling of the vitreous and the retina and things that we talked about. Sometimes you can get little stretch marks in the eye, pieces of pigment that you might see in a picture of your eye. But as the tissue stretches, it gets thinner sometimes in some cases, and that can lead to easier retinal tears. So that's a risk. Having surgery in your eye is always a risk because everything's getting stirred up, getting pressure on it, and especially cataract surgery when they're going in and doing that kind of an invasive thing can lead to risks of retinal detachment. But the risk is so minimal. I don't want to scare anybody about being nearsighted or having surgery on their eyes. If you need to, you need to. LASIK, not much risk, okay? Don't worry about that. Surgery's on the front of the eye. But, it's just, I'm just letting you know some things that could potentially influence it. Alright, so that's going to wrap it up for floaters, flashes of light, and retinal detachments. I hope you guys learned a lot. If you want to see anything about ophthalmic migraines, that's going to be coming up in the next video, kind of a similar topic. I hope you have a great day, and I hope I see you in the next video.